I'd like to start by acknowledging and thanking many people who helped us put this new first release Long Island Sound Beach Report together. In particular, our funders at the Long Island Sound Funders Collaborative, who also have supported and underwritten the Long Island Sound report card, which focuses on what we call the fishable part of the Clean Water Act. How's the water quality for fish and marine life? And this report, the beach report, focuses on what we would call swimmable water quality. So how is it for human contact and primary recreation? In addition to our team at Save the Sound, we had a wonderful science advisor on this project, Professor Gregory O'Mullen from Queens College, brought a lot of expertise and support to the project. So the beach report is based on data that is available on a website that we maintain called the Sound Health Explorer. And what you see right now is just a screenshot of what the Sound Health Explorer looks like. We did update this tool when we were working on the beach report, and I'm going to go into how we changed our grading schema. But just in terms of starting with what the scope of the report is, we basically, for the website and the report, we take the monitoring data that is collected by departments of health all around Long Island Sound. The beach monitoring data is collected in accordance with the Federal Beach Act, and then it's submitted to EPA and put into a database that is open source. So we designed this tool, the soundhealthexplorer.org, to scrape the data out of that database and put it into this website. We combine it with other data. Most relevant to the grades is the rainfall data. And then, as you can see in the bottom right-hand corner, for people who want to do a deeper dive, they can also look at other things that relate to beach water quality by turning those layers on. So the beach data that we are grading is what we call fecal indicator bacteria counts. So the recommended fecal indicator bacteria that's used by New York and Connecticut is enterococci. We call it entero for short. And what that does is that really tells you, is there fecal bacteria in the water, and at what level of concentration is it present? When people go swimming, the thing that really makes swimmers sick is exposure to pathogens, or this whole kind of universe of potential disease-causing bacteria that travel in fecal bacteria. So there's a lot of different pathogens people can be exposed to, and it would be kind of unrealistic to monitor each of the individual pathogens. So the standard practice is you look for if there's fecal bacteria in general, and then you open and close beaches based on the presence and concentration of that bacteria. So that's what's in the tool, that's what's in the report. We focus on swimming beaches. There are some other passive beaches on the Sound, but only beaches that monitor and report that data back to EPA are available for us to include in this report. I will also mention sometimes there are private beaches that don't monitor. If a private club chooses not to get a license beach or put out a beach stand, they can keep a beach open and not monitor. That's kind of a limit your own risk situation. So they would not be included in this report. But we do have 204 beaches, so it's a lot. There's a good spread, and there's a lot of good stories to tell. So the grades. So the first iteration of this website, we just looked at frequency of failure in wet and dry weather. So when I say failure, we're talking about the Connecticut and New York State recreational water quality criteria, which, as I mentioned, is based on the concentration of enterococcus in the water. So there's a cut point at 104 colony forming units per 100 milliliters. That is the states follow. So if you have less than 104, you stay over swimming, and if you have more than 104, you should be closing the beach until that number comes back down. That's our pass-fail and what we would call the frequency of failure. So how many times in a given swim season does the beach have greater than 104 entry count in its samples? So in addition to how it fails, which as I mentioned is what we were reporting on prior, we decided this time to add another level of refinement by including what's magnitude of failure. So how high does that failure go? And we decided to do this because we noticed that a lot of the smaller beaches where they don't monitor very often, little neighborhood beaches, could have like a low-level failure, maybe a 120 or even a 105, and see their grade drop the way the tool was designed before, as far as if we had a beach where they had a failure and it was 1,500 or 2,400. And we didn't feel that that was an accurate reflection really of the quality, because in addition to wanting to know whether or not it fails, the concentration of, the contamination is really important for people to understand the relative health risk at any given beach. So with this grading scheme, we are taking the highest concentration in any given recreational season. So it's the worst failure, the highest concentration any beach ever experiences, and we're adding that into our grades. So we have a score that shows how often a beach fails the cut point in dry weather, how often it fails in wet weather, and then we give a score to how high the concentration of the fecal bacteria contamination is, both in dry weather and wet weather, and then we combine those 4 scores into an overall grade. I did also put a note on the screen here that New York and Connecticut have not adopted the new EPA recommended recreational water quality criteria that was released in 2012. So that's just something on Save the Sound's advocacy agenda to get New York and Connecticut to update to the latest best practices. I'm happy to take questions on that at the end if people are interested in more information. So the second thing that's important to know about our grading is we had to set a minimum concentration, or I'm sorry, number of sampling events in order to assign a grade. So one thing that really, when people say, what's the best grade and what's the worst grade on Long Island, or the worst beach on Long Island Sound, I have to say the worst beach would be the beach that isn't monitoring, or the beach that isn't monitoring enough to meet the minimum state and federal requirements of a once a week monitoring. Because, without the information, we're really not managing the public health and public interest properly. So I think the beaches that get the gray scores for not enough data are the worst, even if the scores they do have data for make things look good. So in the report, when we had less than 9 samples for a whole recreational season, we assigned it an NA or a gray. So sometimes we had beaches that weren't sampling in wet weather, and in that case we didn't want to give them an unfair advantage because a lot of the failures happen in wet weather. So we decided to assign beaches that had no wet weather samples also in NA, and we didn't select any of those beaches for the 10 best list. Now this slide shows us that there is so much variety in water quality at beaches, and really surprising to the public is how you can have A+ beaches and C beaches so close to each other, and even D beaches. So this is an illustration of this. It shows you 3 sample beaches in Nassau County that you can see are right next to each other up there in the Glen Cove area. This happens because the water pollution that is measured for beach health, fecal bacteria concentrations, occur very locally. The fecal bacteria gets diluted and spread around with the tides, and it also, the bacteria will be disinfected by the ultraviolet rays from the sun when it's out in the environment for a long time. So generally you don't see this enterococcus traveling really far away from its source, unless you have a very big concentrated plume, like maybe a combined sewer overflow. But usually when you see poor beach water quality, it means that there's something from the landscape right near that beach that is getting into the water. And it could be if there's a stream or a creek or maybe a storm drainage pipe, then you've got a bigger landscape because you're draining from a bigger watershed, or it could be something very close and local in the beach area. So the good news is, because this is such locally occurring pollution, that people can actually find problems and address them locally. So people who really are invested in having an A+ beach on the Sound can take local actions, understand what's triggering pollution in their local community and clean it up. And we've had examples of communities that reach out to us when we issue our annual press release, when these grades come out every year on the Sound Health Explorer. And we've had some good success stories collaborating with communities on local solutions and getting improvements to water quality. All right, so this is not our official list, I must say, in our report card of our 10 best, but I wanted to put this up, and then I'm going to show you the 2 lists that we ended up publishing. But first I'll start by saying, we feel that in general, this is really a good news report for the Sound. The overall samples, when we looked at all of the beach monitoring for 3 years, from 2016 to 2018, overall 93% of the samples passed, and just less than 7% failed. So that's a good, respectable pass rate. In general, you'll see that communities have been smart about where they place the beaches. They've done work looking at water quality, and some beaches that are chronically poor performing, do get shut down over time. So I'll go in more detail into both the pass and the fail data, but let's just start with what everyone wants to know about, which is, what are the best beaches? So these are the top 10 when we just looked at all of our beaches and combined Connecticut and New York. And we decided that we really didn't want to put private beaches in the top 10 list. So I flagged at this first pass what ended up being private. And honestly, we had to start going pretty far down the list, especially in New York, to get 10 public beaches. And the more we knocked out the privates, the more the overall top 10 just started to be a lot of Connecticut beaches. So we decided to create 2 top 10 lists. So we have the best 10 New York beaches and the best 10 Connecticut beaches, because once we put this filter of public access on it, it just wasn't giving our New Yorkers enough options of where to go. But I want to take a moment and just highlight that public access to the Sound is so important, and something that Save the Sound really values and keeps an eye on. Overall, only 20% or 40 beaches could we confirm as being 100% public. 70 other beaches, or 30% in our report, are municipally owned. And usually municipal beaches are limited to residents through either some kind of a resident permit or some other proof of residency. So we haven't gone through and found out exactly which of those, how many of those, I could go to if I don't live in that town, but probably half or less. And then overall, about half of the beaches on the Sound are private. So I would say between the municipal owned and the private, we're probably looking at 25 to 30% of the beaches on the Sound are open to everyone. So I'd like to see that number higher. these are the 10 best lists that we published in the report. So even with these, we ended up putting an asterisk onto some beaches that are only for local residents, because honestly, we started to get far enough down in the list that we weren't feeling very excited about some of the scores at beaches further down in the list. So this is a combination of public to everyone or public if you live there. And if you throw in the private beaches, you know, there's a whole lot more amazing beaches around the Sound. Okay, so now we're going to drill into the findings in a little more detail. So this chart talks about the frequency of failure, that half of our grading assessment. And we break the frequency grades into the wet and dry scores and performance. So overall, when we look at all of the samples for those 3 years, 2016 through 2018, so you saw the overall pass on the prior screen, which was, so we had 93%, 93.3% overall pass, 6.7 fail. When we break them into wet and dry, 5.4% of the time that we had failing samples, they happened in dry weather conditions, and 11% of the samples that failed were in wet weather. So basically what you're seeing is when you pull them apart by weather conditions, there's a doubling in frequency of failures. And this isn't a great surprise. We know that rain is basically a delivery system of pollution to our beaches. And especially beaches that are near tributary creeks, rivers, or streams, or any kind of stormwater infrastructure, or a combined sewer overflow where you'd have untreated sewage and rain bypassing in wet weather, which happens in just some of the big cities on the Sound. So we know in these areas that wet weather means temporary degrading of beach water quality. And in most communities that experience this, maybe all, I haven't made all those phone calls, but you know, generally the best practice is if you know you have wet weather contamination at your beach, they just preemptively close them when they rain. And in most communities, I know, for example, Westchester and communities in Fairfield, Nassau and Suffolk, they definitely have a sense of how much rain at certain beaches. So, you know, a 1/4 inch, you close a certain list, a 1/2 inch, you go to a bigger list, et cetera, et cetera. One of the interesting things about this chart, as you'll see, is, you know, when you go to Westchester, New York City, where you have New York City's massive combined sewer overflow system, you see a really much bigger failure rate. The pass in dry weather is actually not too bad, but then you have a tripling of failed beaches when it rains. Whereas in Suffolk County, you have fewer in the wet weather, but you actually have, you know, not as good of a performance in dry weather. So the difference between the dry and the wet, while still doubling in Western Suffolk, isn't as extreme. So there's something else going on there. I'll also just mention while we're on the slide that in addition to bringing fecal bacteria to the coastal environment when it rains, that storm water running off our landscape and through our storm system also brings other pollutants of concerns. So it brings fertilizer runoff that can, you know, increase nitrogen concentrations and feed algal blooms, and it brings marine debris and plastics and toxins from the road. So those aren't measured typically on whether or not a beach is opened or closed, but people certainly see that debris and the impacts of those contaminants, and they certainly impact popularity of some beaches. Oops. All right, so this chart now looks at similarly the other half of our scoring system. So we're looking at the magnitude or the concentration of fecal bacteria. And again, for this data point, we took the highest magnitude at each beach in each season. So it was one data point for each beach each year over 3 years. And this is what we came up with. This is what the data showed us. So you'll remember the cut point for passing is 104. So you can see, and these are averages of the highest. And I can tell you that there are beaches that go into the 1,000, 1,000 to 2,000 range sometimes when they fail. But this just shows the average of those highest numbers for each of these regions. So these patterns are more complicated. In the Western region, including Nassau County and Westchester, New York City, the greatest concentration, as we would expect, the greatest magnitude is in wet weather. So that's why the blue bars are larger there. And in dry weather, they have failures, but the failures aren't as filthy. But then when you look in Connecticut and in Suffolk County, the greatest magnitude of contamination is actually in dry weather. So this came as a surprise to us. It reflects differing sources of pollution in these different regions. For example, people out in Suffolk County know that there's a big issue with groundwater contamination from septics. So something like a septic contamination that is leaching to the beach through groundwater could be a 24/7 dry weather source of contamination. There also could be beaches and wildlife contaminating these locations in dry weather, but it really was a surprise. And also, Western Connecticut, you can see some really big dry weather failure numbers there. So this is something that now that we've done this analysis, we'll be looking at more and trying to get some better understanding about these dry weather failures. So then this is my last chart. This one is showing people how the regions are doing and how they compare to one another. Fortunately, the beach grades are good enough that we only went to a C with our chart. There was no point in putting D's and F's because none of the regions dipped down that far. And as you can see, most regions stay pretty solidly in the B area with a little C and some A in some communities. So a lot of variety by year. So this is each of the grades that we assign to the beaches in these regions. We made an annual average based on the grades, and then we plotted those over this 10-year time scale. So looking at the top for the New York region, you can see, not surprisingly, that Suffolk County out east, is consistently higher and at the top of the chart. And Nassau County, which is west, kind of tracks along further below. This is consistent with other pollution trends that we see where you have a higher concentration of pollution in the Western Sound, and as you go east and you get closer to the Atlantic Ocean and the dilution and lower concentration of population out there, you generally see an east to west gradient of less pollution. But we also see this really surprising shift in 2018 where our Suffolk County lines, which tended to kind of float above the fray, took a dip. That's something we're also looking at and have spoken with Suffolk County Department of Health about the data and our concern there. And then you also see some bumps up and down around different years when there were bigger rain events or storms that had impacts across the whole region. You can see that in 2013, for example. So a lot of information here, but just trying to give a kind of a snapshot to give you a sense of what we're seeing and how the different regions compare. And then back to the Sound Health Explorer for a minute. So I'm guessing this raised many questions for people, and people really tend to care about their local beach and where they swim and want to drill down and get more information. And we really want people to do that as well. So I'm going to wrap up by showing you how you can use the Sound Health Explorer tool to get more information on the beach in your community and answer some of your questions. And then I'll share a link to where you can download the print report, and then we'll open it up for questions. So what we see here again is a Sound Health Explorer tool, which I mentioned earlier. If you click on any of these grades, you'll get a pop-up window that shows you the grade for that year. So we see you can click year by year by year, going all the way back to 2004. So for each year, you get an overall grade, and then you see the component elements. So how this location fared. So this example here did really well in dry weather, and when it did fail in dry weather, it just failed a very small amount. But it did have failures, pretty consistent failures in the wet weather, although those failures were not of a very high intensity. So if this was red and it was having big failures, this would have been a C or lower. But because even though it failed a bunch in wet weather, it just was kind of just over the line, smaller fails. So it got a C there instead of a D or an F. And that adds up to the B. And then if you click again, actually on this link where it says enter site view for more information, this is what we call our site view, where we go beach by beach. This is a drop-down menu, and here we're showing you the interactive spreadsheet where you can actually go in and see every single day that a sample was collected, what the score was. And remember, again, it shows us 104 is our cut point. What was the score? And then we show how much rain fell during the 48 hours before that sample was collected. And if it was considered a wet weather event, which would be 24 inches or greater rainfall, we make it blue. So you can kind of quickly scroll through and see, oh, is that, was it raining? Wasn't it raining? And what kind of failure rates you had. And then we have summary data here. And of course, you can turn on the other points of interest and see if you're near a wastewater treatment plant or what your local coastal watershed looks like, and a whole bunch of other useful information. So really encourage everybody to spend a little time on the tool if you have questions, and also to go to savethesound.org. You see our website on this page. You can download the beach report from savethesound.org. There's a tab at the very top of the page right now with a link. And we hope you'll look at that and learn some more about the beaches in your community. Our goal for the report is really to take the publicly available data and make it more understandable and more quickly digestible and actionable by communities. And the print report, in addition to providing all the grades and the how-to on how to interpret the grades, goes in greater detail about the different pollution sources and then provides actions that residents and communities can take, both in terms of improved stormwater management, improved wastewater infrastructure, improved monitoring, and other things that people can work on if they're concerned about the water quality in their community. So that is the end of our presentation. If anyone has questions, now would be the time to pop us a message. And otherwise, you have Martin's email up on the screen here. If you think of something after we get off the line, feel free to email him and he'll get back to you with an answer. Okay, so with that, that is a wrap. Thank you everybody for joining today. Really appreciate it. And enjoy our beautiful Long Island Sound beaches and the rest of the summer.